And oftentimes it happens. You feel like you're alone, and you feel like it's only you.
The Rock, Dwayne Johnson there, and he is mostly incorrect, because you're not alone. There are plenty others out there that are depressed and that have seasonal depression as such. So let's look at seasonal depression and check out exactly what you can do. First of all, it's really important for you to actually seek the advice of a medical professional, get a one-to-one consultation. Now, that said, they might see many things and say many things like this. So let's look into what they might see first off. Seasonal affective disorder. Even with a thorough evaluation, it can sometimes be difficult for your doctor, it says, quote unquote, or mental health professional to diagnose seasonal affective disorder, because other types of depression or other mental health conditions can cause similar symptoms. Now, there's a lot of, well, if, buts and maybes right there, aren't there? I mean, if we break down that little paragraph right there, that sentence as such, it's saying that it can be difficult. It can be difficult. So why can it be difficult? I'd question that. I'd wonder. And for a doctor or mental health professional to diagnose. So there's two different professionals there. Thankfully, that's a good thing. Two respected ones too as well. But which one is better? You know, I mean, if I have, which I don't thankfully have any of these ailments, but if I was, I'd be wondering that, especially if I wasn't feeling well and not trusting my own judgment and organizational behavior within my mind, because effectively that's what's going to be affected with your depression, isn't it? And then you have other types of depression that might actually go and challenge their evaluation, a doctor's evaluation or a mental health practitioner's evaluation of what you're actually feeling. So you're kind of left to wonder, I'm confused. I said I'm not depressed at all, far from it. But I can see how there's a lack of clarity even in that particular sentence, and this is from a very reliable source, the Mayo Clinic. Now, that said, they do go and say, with diagnosis SAD or seasonal affective disorder, your mental health practitioner or your doctor will then go through an evaluation that will include 4 main areas. According to them, it's physical exam, lab tests, psychological evaluation, and DSM-5. We'll get to that in a second. Physical examination, your doctor, well, they'll look you up and down, basically. They'll do all they need to do physically, and they'll try and figure out what is coordinating with your feelings of depression. Now, often your feelings of depression and anxiety can be interlinked. One can lead to the other. You can actually start to begin to question, is it coming from your mind? Is it, just seasonal, or will it actually affect you ongoing towards the spring, summer, and so on, towards other aspects of your life? Like, for example, when people have postnatal depression, they're obviously not thinking in a very good manner with regard to how they feel, so they might question the fact that, hey, is it postnatal, or am I going to suffer bouts of depression in the future? It's the same with this seasonal affective disorder. You might begin to feel that you might question it in the future about whether you're going to have depression in the future. So, and more often bouts of depression, that is. So again, physical examinations, the reason why doctors would do this is because they're trying to see a link between physically how you feel and are there physical symptoms essentially linked with how your mind and your body are coordinating, such that your mouth, of how you display your problem of saying, if you go to a mental health practitioner or doctor and say, hey, I'm depressed, well, the doctor has to go, well, you think it's depression, so I have to define if it's depression or not. So they have these tests, and your body can actually show signs of depression, believe it or not. It can also talk to your mind, for want of better words, to actually link up and see. So exactly how you're feeling can coordinate and manifest physically on the outside as well. So again, one simple thing of that is posture. If you're not feeling well, you might actually exhibit posture that's not very positive. So in exhibiting that, you might slump your shoulders. Here I am doing it right now as I'm leaning forward. You might be feeling down, and you're looking down, and then looking down, it's the old saying that you're feeling down too, and it's very, very true. So these are some of the things and some of the physical attributes that could be going on possibly in a good physical examination. Lab tests are another thing. Here you have bloods and thyroid, it says here, and a complete blood test as such. So these are looking into the nitty gritty, because essentially, how we feed our blood through the nutrients we put into it, through our diet, through how even down to the typification of such as our thinking can then flow to other areas of our body. So if we feel depressed and we're having doctors check out our bloods, that's a good thing. But the bloods might travel, remember, and to other areas of our body, giving that knock-on effect of being slumped over, or changing certain ways that your body actually interacts with the world. And so your physical examination and your bloods are going to work together for the doctor to kind of have some sort of assumption of what's going on. Then the psychological evaluation and the signs of depression, or your mental health practitioner or doctor will look at these too. So there's all these different things before you go to DSM-5, which is your mental health criteria for seasonal depressive episodes. And of course, the one thing about it is, if you don't go to people, you might logically say, well, if it's only seasonal, I'll just wait till the season ends. And that can be very true, because it's only a time period according to this. And then we go back to the earlier sentence of, quote unquote, even with a thorough evaluation, it can sometimes be difficult for your doctor or mental health practitioner or professional to diagnose seasonal affective disorder. So again, if you went to a doctor today, they did really good tests, they're a brilliant doctor, and you go back to them next week, the season may have changed somewhat, your feelings may have changed, their thinking on it may have changed. So there's where the problem lies and where there could be problems. Now, it's looking here at light therapy, which is really interesting too. Here you can sit a few feet from a special light box so that you're exposed to bring light within the first hour of waking up each day. Again, it's not particularly known how effective this is. This particular therapy it's generally in its early days. It generally starts working a few days after you first start doing it, and although the research is limited, this is not a criticism of light therapy as such, but it's the fact that with regard to one therapy, you have to check it out for its effectiveness to all different things and all different ailments and symptoms. But if you're looking at seasonal depression, which is only obviously one part of the whole matrix of depression itself, and then you look at it from a short-term perspective of a certain amount of time, and a short-term perspective only has a certain amount of people in it that are using light therapy, you have only got to look at the research in and analyze it in a certain way, because it's really not reflective of what would happen with a lot of people with seasonal therapy. One of the things, of course, for any type of seasonal thing, a therapy that is like light therapy, is going to be, well, if you have it today, the seasonal depression in America, there's others that mightn't have that in Europe, because it might be slightly different season going on. One might be entering in while the other one is entering out, or in China as opposed to America or Europe, and so on. So there's different parts of the world, there's going to be different types of seasonal changes. Then you throw in the whole thing of global warming, and it's very difficult, because we definitely have warmer temperatures in some parts and different things going on, weathers and so on, in different parts of the world. Medications then can be looked at as well, and will be looked at probably by your mental health practitioner. If they're psychiatrists, for example, they will probably more than likely have the licensure to be able to give you, or at least advise you to taking certain medications. Now, not every medication is very, very successful. Now, this particular video isn't all about medication or anything like that, but one of the things that this particular article is looking at is antidepressants. And again, the research is out there with regard to this. Now, it says here, quote unquote, in this paragraph, your doctor may recommend starting treatment with an antidepressant before your symptoms typically begin each year. So the question with that sentence is, how do you feel? How are you knowing that you're going to get the seasonal depression if it's seasonal in the first place? If you didn't get it last year and you get it this year, how do you know you should take the antidepressants before it? So it's kind of like a chicken and an egg. You don't really know until you know, and you won't know because you haven't or have taken antidepressants in the first place, which of course are going to change the chemical areas of your brain that possibly could be feeling depressed. So it's up to you, it's up to yourself and your doctor, but I would definitely ask them all those questions. And keep in mind that, you know, depression is a serious thing. I'm by no means giving advice here about depression. I'm just looking into seasonal depression with regard to this particular article and giving a pretty holistic viewpoint from the different treatments that are out there, another of which is psychotherapy and mind-body types of therapies. And it's really important to try and go to your medical professional again and ask them their advice.